Welcome. This recording will review gram-positive pathogens in antimicrobial therapy, followed by 5 multiple-choice practice questions to assess what you've learned. First, let's review characteristics of the gram-positive bacteria. Gram-positive bacteria have a thick peptidoglycan cell wall, which when stained with crystal violet absorbs quite a bit of stain, giving a purple appearance when looking under the microscope. There are many gram-positive bacteria, however, we're only going to review the most common pathogenic species. Gram-positive bacteria are divided into 2 categories based on the shape when looking under a microscope. Cocci are circular-shaped bacteria and include Staphylococcus, Enterococcus, and Streptococcus species. Bacilli are rod-shaped and include Corynebacterium, Clostridium, Listeria, and Bacillus. Let's start with gram-positive cocci groups, Staphylococcus, Streptococcus, and Enterococcus. If the initial gram stain shows gram-positive bacteria in clusters or groups, the species is most likely Staphylococcus. Gram-positive cocci in chains are common in Streptococcus species, and short chains or pairs are seen in Enterococcus species. Staphylococcus aureus is a normal flora species found on the skin. However, it's also one of the most common bacterial pathogens to cause infection. There are 2 types, methicillin-susceptible Staph aureus and methicillin-resistant Staph aureus. Beta-lactam antibiotics are effective in treating methicillin-susceptible species, but not the methicillin-resistant species. The most common streptococcal bacteria to cause disease in humans are Group A, Group B strep, and Strep pneumoniae. Group A strep causes strep throat, Group B is known to cause disease in newborns, and Strep pneumoniae known for causing ear infections and pneumonia in the pediatric population. Beta-lactam antibiotics are first-line agent used to treat infections caused by these bacteria. Enterococcus faecalis is a normal flora bacteria in the GI tract, however causes infection in other systems like the genitourinary tract. Beta-lactam antibiotics are effective in treating these types of infections. VRE superbacteria is a pathogen that does not respond to antibiotics due to bacterial mutation and can be deadly to vulnerable populations. Reviewing gram-positive bacilli, Corynebacterium, known to cause diphtheria, is mostly eradicated due to vaccination, and Bacillus, a pathogen known to cause anthrax, is rare and treatable by a variety of antibiotics. Infections caused by Listeria are also rare but can be fatal if not treated. Last, the Clostridium species is one we'll discuss next. Broad-spectrum antibiotics will kill the intended bacteria causing infection, but unfortunately kill normal flora bacteria like C. diff. C. diff, a pathogen that normally resides in the GI tract, can survive antibiotic therapy while other normal flora are killed. This overgrowth of C. diff can cause a variety of undesirable gastrointestinal symptoms. If overgrowth of C. diff has occurred and the patient has symptoms of illness, targeted antimicrobial therapy will be required. Common agents used to treat C. diff infection are metronidazole, fidaxomicin, and if necessary, vancomycin. Beta-lactam antibiotics are those which have a beta-lactam ring in the molecular structure. The penicillins, carbapenems, and cephalosporins are considered the beta-lactam antibiotics. Because these 3 categories are molecularly similar, a patient who has a hypersensitivity reaction to one category may have the same or a more severe reaction to a drug from one of the other categories. Penicillins and carbapenems have many similarities. Common suffix you will see in the drug name is -cillin and -penem. These drugs work by disrupting cell wall formation during bacterial replication. Adverse effects include hypersensitivity, GI upset, and effectiveness of oral contraceptives are impaired, therefore backup birth control methods should be used. There are 5 generations of cephalosporins. You can identify a drug as being cephalosporin if the prefix begins with CEPH or CEF. To distinguish each generation, there are some unique patterns in the drug names. First generation cephalosporins will have FA or PHA in the name, for example, cephalexin or cefazolin. Skipping to third generation, ONE, TEN, or IME will be in the names such as ceftriaxone, ceftibuten, or cefotaxime. Fourth generation have the letters PI, for example, cefepime, and fifth generation has TOL or ROL, for example, ceftalozane or ceftaroline. Any other name combination falls into second generation, such as cefuroxime or cefotetin. Each generation has unique pathogen coverage that ranges from gram-positive beginning with first generation, progressing to more gram-negative and less gram-positive coverage in the second and third generations. Pseudomonas coverage is added by fourth-generation cephalosporins. The acronym LAME represents pathogens that cephalosporins do not cover: Listeria, atypical pathogens, MRSA, and Enterococcus. In 2015, fifth-generation cephalosporins were released, adding coverage of MRSA, leaving the popular acronym with only the L, A, and E. Cephalosporins work by preventing bacterial cell wall formation. Adverse effects include hypersensitivity reaction and GI upset. Because the cephalosporins bind with albumin, innate substances like bilirubin can be displaced, leading to jaundice. Therefore, cephalosporins should be avoided in the newborn population. Vancomycin is an antibiotic reserved for severe infections where gram-positive pathogens are suspected. Vancomycin prevents bacterial growth by inhibiting bacterial cell wall formation. Adverse effects can include nephrotoxicity, ototoxicity, rashes, and a skin phenomenon called erythroderma. Severity of erythroderma can be minimized by pretreating with the antihistamine diphenhydramine. Vancomycin is a time-dependent killer, meaning that serum levels must remain in a therapeutic range. Trough levels measure serum drug levels to ensure the dose and frequency are in an ideal range to treat the infection while minimizing adverse effects. Next, Metronidazole, an antiprotozoal antibiotic that works by preventing DNA replication, thereby decreasing replication of pathogens. Hallmark adverse effects include GI upset or metallic taste. If alcohol is consumed while taking metronidazole, a disulfiram reaction can occur, therefore alcohol should be avoided. Now let's see what you've learned by doing some practice questions. There will be 5 multiple choice questions that you'll have 10 seconds to choose your answer. If you need more time, just pause the video after the question is read. On a gram stain, which 2 pathogens appear as cocci in chains? Group A Streptococcus, Streptococcus pneumoniae, methicillin-susceptible Staphylococcus aureus, methicillin-resistant Staphylococcus aureus. Gram-positive cocci in chains represent pathogens from the Streptococcus family. Group A Streptococcus and Streptococcus pneumoniae fall into this category. Gram-positive cocci in clusters represent pathogens from the Staphylococcus species. Of the following, which antibiotic is not considered a beta-lactam antibiotic? Penicillin, cephalexin, ertapenem, metronidazole. Metronidazole is not considered a beta-lactam antibiotic. Penicillin, cephalexin, and ertapenem are categorized as beta-lactam antibiotics. Benadryl may be required to reduce erythroderma associated with which one of the following drugs? Penicillin, gentamicin, vancomycin, ceftriaxone. Erythroderma, previously referred to as red man syndrome, is a hypersensitivity reaction associated with the drug vancomycin. Benadryl can be given 30 minutes prior to giving vancomycin in patients who have this drug reaction. Benadryl helps reduce the severity of the hypersensitivity reaction. A disulfiram reaction can occur if alcohol is consumed while taking which antibiotic? Metronidazole, imipenem, penicillin VK, vancomycin. If alcohol is consumed while taking the drug metronidazole, flu-like symptoms known as a disulfiram reaction may occur. Keep in mind, alcohol can be in a variety of over-the-counter medications and substances that people use every day, like mouthwash. Therefore, make sure the patient is aware of this risk. A serum trough level should be measured in a patient receiving vancomycin 30 minutes before the 3rd dose, 30 minutes after the 3rd dose, 30 minutes before the 4th dose, 30 minutes after the 4th dose. A trough level should be drawn 30 minutes prior to the 4th dose. This helps determine the efficiency of the antibiotic dose and frequency, with optimal levels between 10 to 20 micrograms per milliliter. That wraps up our presentation on gram-positive pathogens and antimicrobial therapy. We hope you enjoyed learning with us.